tell us a little bit about what you've learned with these figures. I mean, it sounds pretty startling, the number of people dying during pregnancy or soon after being at the highest rate for almost 20 years.
That's exactly right. So I do want to start by emphasising to women that maternal death, so death during pregnancy or up to 6 weeks after pregnancy, is still rare in the UK. We're talking about 13 women for every 100,000. But it's widely recognised that maternal mortality rates are a measure of the health of the whole maternity care system. And there's no doubt that this rise is particularly concerning.
And there are racial inequalities as well, aren't there?
So we've known that there have been significant racial equalities between maternal mortality rates for Black women, Asian women and white women. And these figures show that Black women are still 3 times more likely to die compared with white women. And for Asian women, that's their rate is double that of white women.
So why is this happening?
So we can see from the figures that there are particular increases in, for example, deaths of women from blood clots. And we know that in many instances, those blood clots are occurring in women who are overweight and obese. And we do need to think about pre-pregnancy health and thinking about making sure women are as healthy as they can be before pregnancy. But we also can see signs of maternity systems under pressure. And it is of particular concern that we're seeing these rates increasing when we know that there are many pressures on maternity units. And it's not just the few units that are hitting the headlines with significant maternity inquiries. We've got to think about the whole maternity system and how we need to make sure that we're providing the care women need.
And the dates that these figures cover are from January 2020 to December 2022. And of course, that will beg the question, how much has COVID got to do with this?
It's a really good question. And actually, 38 women died from COVID, not just with COVID, but from COVID. But when we exclude those women's deaths, we still have a statistically significant increase in maternal deaths compared with the previous 3 years. And what's particularly concerning is that increase is largely in direct causes of death. So those conditions that we typically think of as pregnancy related. So things like preeclampsia, high blood pressure, bleeding in or around childbirth, but also mental health related causes. So maternal suicide. And so those are very much conditions that are experienced by women in and around childbirth, and so indicate that we need to be thinking about maternity services as well as the wider care system for pregnant women.
And also, what have you found out about what difference it can make whether or not you come from a wealthy background or a deprived background? Does that feed into the figures at all?
It's a particularly stark finding that for women that live in the 20% most deprived areas, they have more than twice the mortality rate of women who live in the wealthiest 20% of areas. And it's important to recognise that the ethnic disparities that we see are not solely due to differences in wealth. So we are seeing that that access to care for women from those areas which are less affluent is clearly impacting on their overall maternal health.
The government might point out that it's investing millions in maternity services. You say the system needs to be looked at. What would you like to see happen?
So I think there are many things we need to see. I think we need to recognise that pregnancy health is everyone's responsibility. So we need to recognise that you should be trained in pregnancy health wherever you are in the healthcare system, so that if a pregnant woman is admitted under your service, or you are seeing them in accident and emergency or a clinic, you know what to do, or you know who to speak to. We know that we need more midwives, but we also need midwives who are trained to care for women who have complex and pre-existing conditions, both physical, mental and social conditions. So we need to recognise that the population of women giving birth now are not the same as the population of women giving birth 20 years ago. Women have many more health conditions that we need to care for. And importantly, we need to recognise the wider public health measures that we need to put in place to make sure that women are healthy before they become pregnant. So thinking about obesity, physical activity, environment, so that we are enabling women to be as healthy as they can be before they choose to have children.
OK, well, Professor Marian Knight, really interesting to get your thoughts on these statistics. Thank you so much for joining us this morning.